So, okay, good day to everyone. Johnny Balneo here, your clinical instructor for this subject, health assessment. And today, we're going to have a little discussion regarding the BP taking. So, ano yung tama na pagkuha ng blood pressure? Because I knew for sure na familiar na kayo with blood pressure taking. Some of you already experienced how to perform this one in a hospital nung nagkaroon kayo ng immersion nung senior high school kayo. Some of you are already familiar with this one kasi merong family sa inyo na nurse din or doctor or health practitioner. Okay, what else? For today, we're going to see ano yung tama na dapat natin gawin at ano yung mga mali na dapat nating iwasan. So first of all, we need to assess our client for any clinical manifestations, signs and symptoms ng hypotension or kaya naman hypertensions. Kaya na-discuss ko naman sa inyo to during our lecture, ano yung mga clinical manifestations na makikita natin if a person is suffering from hypotension or hypertensions. Ano pa? What are the factors that may affect the blood pressure? Okay, na-discuss ko na rin naman sa inyo ito in our lecture, so hindi ko na ito i-identify pa. Because there are different factors that may contribute in the blood pressure of our client, such as the environment, the medications, the stress, etc. Okay? Next, we have to determine also the policies and procedure na meron sa isang facility or hospital kung saan tayo magjo-duty. What else? We also need to check, or should I say determine, kung ano yung medication ng pasyente natin. Medication na tinitake niya. So, saan natin makikita yun? Simple lang, dun sa my chart ng client natin. Because there are certain medications that may increase or may decrease the blood pressure, such as furosemide. Ang furosemide po is nakakapagpababa ng BP. So, kailangan i-check natin ano yung mga medications na pwedeng maka-alter dito sa may gagawin nating measurement. So, okay. After determining, let's move on to the planning. Ano dapat nating i-plano? Okay, of course, we have to plan for the sphygmomanometer. Kailangan meron tayo ito. Assemble natin yung mga materials and equipment na gagamitin natin, such as the sphygmomanometer, the BP cuff. Okay, and then we also have here the bulb. So it comes in one. So magkakasama na yan. So some they call it the BP apparatus. Okay, so magkakasama na yan. Dalhin na natin. Kung ang ginagamit natin is katulad na ito, merong gulong, okay, dalhin na natin ito dun sa may pasyente natin. Pero kung ginagamit natin is the portable one, well, why not? Okay, na hospital, bibihira naman na may gumagamit dyan ng mga digital na BP app. Okay? So what else? We also have to prepare stethoscope. Siyempre, mawala bang stethoscope? Okay, so we have stethoscope. Ano pa? So after preparing all the instruments, materials, cotton balls. Kailangan rin natin ng cotton balls for this procedure. So bakit? Well, later I'm going to tell you. Bakit? So after planning, let's move on to the implementation. So prior in doing the procedure, you have to introduce yourself and verify the client's identity using the agency protocol. Na-mention ko naman sa inyo to before regarding the GIV or GIVE or GIVE. Okay, you have to greet your client, introduce yourself, verify, and then explain what you're going to do, why is it so really necessary, and how your client will participate in this procedure. So after that, wash your hands and observe appropriate infection control procedure. Pero since ang BP taking is kasunod na to ng ibang vital signs such as temperature, pulse, respiration, isang hugas na lang, maghugas ka before temperature and then perform all the procedure. Pero kung gagawin mo lang naman is you're just going to take the BP, definitely you have to wash your hands. Okay? Next, provide for client privacy. So nasabi ko na rin sa inyo, if the patient has privacy curtain, then use it. Okay, kung wala, we can use also the portable one. What else? We have to place the client in the appropriate position. As you can see here, yung pasyente ko is nasa may semi-Fowler's position. So, kailangan pa po ba siyang ipunta sa may sitting position? No need. Kung ang pasyente natin is comfortable sa ganitong position, hayaan na natin. Okay? What else? Kung ang pasyente natin is nakatayo, definitely, paupuin natin para mas maging relax yung pasyente natin. Ano pa? If the client is on a sitting position, be sure lang na yung paa po niya is it touches the floor. Hindi dapat nagdadangle. Bakit? It can change the BP. To tell you honestly, kapag nagdadangle yung paa ng pasyente natin or hindi nakasayad yan dun sa may floor, there's a possibility actually that the BP might change. Ano nangyari yun, sir? Okay, there's actually rationale kung bakit ginagawa natin yun. And that is something that you're going to tell in our return demonstration. Okay? What else? The elbow, as you can see here, the elbow should be slightly flexed with the palm facing upward or facing up. Okay, what else? The forearm is supported at the heart level. As you can see, this is the heart. Ito po yung heart level. So, paano sir, pagka wala pong ganito occlusion, wala pong pang support, isa sa ginagawa ko in a hospital is, I use my thigh. Ginagamit ko po yung thigh ko, pinapatong ko yung kamay ng pasyente ko dun sa may thigh, nang sa ganun, at least kahit pa paano, naka-heart level. Nang sa ganun, accurate yung data na makukuha natin. Okay, next one, you have to expose the arm kung saan ilalagay mo yung BP cuff. Okay, kung ang pasyente natin naka-long sleeve, as much as possible, okay, unroll natin yung sleeves niya or kaya naman, katulad na to, yung pasyente ko rito is masyadong mababa yung sleeve. So, kailangan itaas po yan. Okay, bakit? Hindi po ba pwede sir na ilagay nilang namin ang sphygmomanometer over the sleeves? Okay, or should I say sleeve? Okay, no. Okay, dapat dun mismo sa may skin mo ilagay. So, ang ginagawa namin dyan, niro-roll up namin ito and then we put the BP cuff. Okay, you have to expose the upper arm. Next, you have to wrap the deflated cuff. Kailangan deflated po ito. Wala dapat hangin because if there's a presence of air inside the cuff, okay, the BP might change. The BP result might change. Okay, so kailangan you have to wrap it deflated evenly around the arm and then you have to locate the brachial artery. So paano po ba natin nilolocate yung brachial artery? Usually guys, ang brachial artery is where? Okay, andito yan. Kaya kung nakikita ninyo sa may video natin yung color, kaya andito, kita yung brachial artery ko andito. Kaya sa may gilid. Okay, so madali lang i-locate yan. And also, maramdaman ninyo there's a pulsation. Okay, pag naramdaman mo there's a pulsation, okay, you already hit the brachial artery. Okay, what else? You have to apply the center of the bladder directly over the artery. As you can see here, okay? Madali naman malaman yun. As you can see here, ayan, artery, right arm, okay, dapat andito yung brachial. Now, if you're going to use the left arm, ito yung arrow, kailangan nakalocate dun sa may brachial artery. Okay, so that's how you put the BP cuff. Okay, what else? Sa mga adult, you have to place the lower border of the cuff approximately 2 to 5 cm or 1 inch above the antecubital fossa or antecubital space. Ano ba yung antecubital fossa or space na yan? Yan yung pagitan ng arm mo, tsaka forearm. Okay, yun yung creases dito. Okay, yan yung pagitan, yun yung creases. So, at least 1 inch or 2.5 cm above the space, doon mo ilalagay yung lower part ng BP cuff. So, as you can see here, ito yung antecubital fossa or the space. So, at least 1 inch ang pagitan ng lower border ng BP cuff. Okay, so isa sa mga ginagawa natin para mas madali itong ma-identify is we put our fingers, at least 2 fingers above the antecubital fossa. Okay, above that, doon mo ilalagay yung lower part ng BP cuff. Okay, so what else? If this is the first time that you're going to check for the BP of your client, ito yung first time, okay, you have to perform a preliminary palpatory determination of the systolic pressure. Again, you have to determine or should I say perform a preliminary palpatory determination of the systolic pressure. So sir, paano po ginagawa yun at bakit po natin ginagawa yun? Para malaman natin kung hanggang saan tayo mag-i-inflate ng BP cuff. And at the same time, alam natin hanggang saan dito sa may sphygmomanometer natin tayo hihinto. Kasi if you will not going to do that, iba kung umabot ka rin ng 200, piga ka pa rin ng piga. Okay, don't do that. Okay, so it's really important na alamin natin or perform natin yung tinatawag natin preliminary palpatory determination of the systolic pressure. So, paano natin ginagawa yun? How to do that? Okay, so paano ba natin ginagawa yan? How can we perform a preliminary palpatory determination of our systolic pressure? Simple lang. Number one, or should I say first one, is you have to locate the brachial artery. So, nasabi ko naman sa inyo that usually ang brachial artery po ay makikita ninyo sa may gilid. So, locate niyo yun. Okay? I-palpate ninyo. Try to palpate and locate the pulse or the brachial pulse. So, kung naramdaman mo na yan, that's a good one. Na-locate mo na. Next, you have to close the bulb of the pump by turning the knob clockwise. So, clockwise po tayo para may close natin ito. Okay, na-close ko na yung bulb natin. Next one, pump the cuff. Okay, papump natin ito until we no longer feel the brachial pulse. So, let's try to pump this one. Okay, naramdaman ko pa rin yung pulse. And then, pagdating sa may 120, hindi ko na nararamdaman yung pulse ng pasyente ko. Okay, so meaning to say, ang systolic most probably ng pasyente natin is nasa 120. Okay, that is the systolic pressure. So, dahan-dahanin natin bitawan, counterclockwise. I-unlock natin yung bulb. Okay? So now, na-locate na po natin kung nasaan yung systolic pressure ng pasyente natin. Okay? So in that case, we will now position the stethoscope appropriately. So hintayin natin about 2 minutes bago natin kuhanan ng BP or bago natin inflate yung cuff natin. At least 2 minutes. Bakit? Kasi naglagay tayo rito ng pressure. So most probably, pagka naglagay pala tayo ng another pressure, mataas ang BP na makukuha natin. So at least 2 minutes, hintayin natin. 1 to 2 minutes will be enough. Okay, position the stethoscope. So as I've told you, ang gagamitin natin dito is what you call this one? Yung bell. Okay? Bell po ang gagamitin natin. So first, you have to cleanse the earpiece. Okay? Using the alcoholized cotton balls. Okay? Alcoholize mo ito, alcoholize mo. Pero kung sa'yo naman itong, if it is your stethoscope, katulad ako, if it is really my stethoscope, sometimes hindi ko na ginagawa, hindi ko na nililinis yung earpiece for a reason na wala namang ibang nagko-contact dito maliban sa akin. Okay? Ngayon, kung merong ibang gumagamit na ito, itong stethoscope, that is the perfect time na dapat nililinis mo din yung earpiece kasi maraming gumagamit, maraming tenga ang pinapasukan ng stethoscope mo. Okay? So you have to clean it. Okay? If your hospital or institution has or using a different disinfectant, okay, why not? Okay, next one, insert the ear attachment to the ear attachment of the stethoscope in your ears. Okay, but prior to that, be sure lang na it is slightly bend forward. Okay, medyo naka-bend po ito forward or naka-tilt, slightly forward. Usually makikita nyo sa mga stethoscope is like this, nagtatamaan. So what you're going to do is, i-bend mo forward, nang sa ganon, mas madali mong may papasok yan dun sa may tenga mo. Maswak siya. Okay, maswak. Next, you have to ensure that the stethoscope hangs freely, okay, from the ears to the diaphragm. Walang sagabal. Okay, baka naman kasi yung stethoscope mo nasa may ilalim ng kamay ng pasyente mo. So pwedeng iba ang marinig mo. Baka ang marinig mo is what? The friction ng kamay ng pasyente mo. So be sure that it is hangs freely. Wala pong sagabal. Next, you have to place the bell of the amplifier of the stethoscope over the brachial pulse. So since andito yung brachial pulse sa gawing gilid, diyan ko ilalagay yung aking stethoscope. I mean, the bell, okay? What else? You have to place the bell over the brachial pulse and then hold it using your index and your thumb. Ang paghawak po is ganito, okay? Ganito po ang paghawak, okay? Some other kids kasi nakikita ko, ang hawak nila is ganito, okay? Naka-place yung thumb dun sa may diaphragm. Ganyan ang hawak nila. Don't do that. Bakit? As I have told you before, ang thumb, okay, it also has a pulse. Okay, so pwede mong maramdaman yung pulse mo, and also pwedeng ang marinig mo, instead na ang marinig mo yung pulse ni patient, ang narinig mo pala is yung pulse mo. Okay, so better, huwag natin gawin yun. Ang paghawak is ganito. What else? Be sure lang din po na naka-open yung inyong stethoscope. Okay, naka-open ang bell or ang diaphragm. Kung gagamitin mo ang diaphragm, be sure na naka-open. Kung gagamitin mo naman yung bell, be sure na naka-open. Paano po ba yun? Okay? Okay, itap mo lang ng konti. If for example, I'm going to use the diaphragm, itap mo lang. Okay, malakas yung sound. Ngayon, ibig lang sabihin nun, naka-open yung diaphragm. Yung bell, kahit na i-take mo yun, hindi masyadong malakas yung mapoproduce na sound kasi naka-lock. Okay, ganun din kapag gagamitin mo yung bell. Twist mo lang yan. Okay, yan. Pag na-twist mo ganyan, ibig lang sabihin, naka-lock na yung bell. Kahit na itap ko ito, mahina ang maririnig ko. Kasi, ang gagamitin ko is the bell, not the diaphragm. Okay? So, be sure na naka-open yung bell or yung diaphragm base dun sa may gagamitin mo. Okay? It depends kung ano yung gagamitin mo sa dalawa. Is it the bell or diaphragm? As I mentioned to you before, in this procedure, sa may BP taking as per Cochere, ang ginagamit po natin dito is supposedly yung bell. Pero there's also a rationale, kung makikita nyo sa mga hospital, gumagamit din po sila ng diaphragm. Or should I say, most of the cases, most of the time, ang mga nurses ang ginagamit, even the doctors, ay diaphragm. So there's also a rationale behind that. Okay? Check nyo na lang ano ba talaga yung mas magandang gamitin. Is it the bell or the diaphragm? Either of the two is acceptable, but again, ang susundin natin is yung nasa may book natin, which is yung kay Cochere. So once again, check ko kung ano yung ginagamit, kung ano yung naka-on dito. Is it the bell or the diaphragm? So, malakas ang tunog dito, meaning, ito ang naka-open. Naka-close po ang diaphragm, naka-open ng bell. So next, Place the bell over the brachial pulse. Okay? Hold it like this. Okay, nakikita ba sa may video? Yeah. Okay? Hold it like this, and now you have to auscultate the client's blood pressure. In order for us to do that, okay? Okay? Pump up the cuff until the sphygmomanometer reads 30 millimeter of mercury, okay, above the point kung saan kinuha natin yung systolic. Di ba sabi ko sa inyo kanina, nakuha natin yung systolic ng pasyente natin, 120. So this time, mag-add tayo ng 30, so 150. So i-inflate natin itong BP cuff hanggang 150 kasi 120 plus 30, that is 150. So hanggang 150, nasa pagitan ng 140 tsaka ng 160. So inflate natin. Kailangan yung dial umabot hanggang 150. Lock the valve. And then, pump hanggang umabot tayo sa may 150. And then, dahan-dahan natin i-open yung valve counterclockwise. Tandaan, dahan-dahan lamang dapat. Sir, gaano po kabilis? Gaano kabilis yan? About 2 to 3 mm of mercury dapat yung bilis niya, yung pagbaba noong dial. So hindi mo to basta-basta bibitawan na lang. Kaya as much as possible, kontrolin mo yung pagbitaw o yung pag-open ng valve. Maliit lang, dahan-dahan lang. Kaya hanggang sa makuha mo yung 2 to 3 mm of mercury. Okay. Dahan-dahan lang dapat. Huwag masyado mabilis. Tingnan natin ulit sa may inflate ko hanggang 150. And then, dahan-dahan natin ibaba. Dahan-dahan lang dapat, around 2 to 3 mm of mercury per second. Okay. So, paano natin malalaman? Okay? How will we be able to check or identify kung ano yung pressure ng pasyente? First, you have to get the systolic. Sabi natin kanina, 120 ang systolic. Kaya upon checking here, narinig ko kanina, okay, itong dial ay umabot hanggang 130. Doon ko narinig yung malakas na sound. Okay? Narinig ko kanina, tugs, 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 tugs. Yung malakas na sound ay tumama doon sa may 130. Ibig sabihin, ang systolic ng pasyente ko is 130. Tapos, yung lowest sound, yung pinakamahinang sound, okay, yung pinakamahinang sound ay narinig ko around 80. So, ang BP ng pasyente ko is 130 over 80. Tandaan natin, yung malakas na sound or usually the third fluctuation, kasi makikita mo, magpa-fluctuate yan. Magpa-fluctuate. 1, 2, 3. Sa may pangatlo, doon mo marinig usually yung malakas na sound. That is the systolic. The diastolic is yung pinakamahinang sound. Okay, usually, fifth sound yan. Pero ang magandang indication dito is yung pinakamahina na sound na maririnig ninyo. Kaya paano auscultating it? Okay? In-auscultate mo, ang pinakamahina na narinig mo ay gawi sa 80. Okay, so the diastolic is 80. So ang BP ng pasyente natin is 130 over 80. Pag nakuha mo na yung diastolic, okay, pwede mo nang i-open ng malaki ang iyong valve. Okay, then i-deflate mo na yung BP up. Okay, deflate mo ito, deflate the cuff rapidly and also completely. And then, when the device, nakuha mo na yung readings mo, well, definitely you have to note the result. What else? Remove na natin yung cuff na ginamit natin and wipe natin yung device o yung cuff na ginamit po natin. So, it depends on the hospital. May mga hospital na may pang-wipe, yung ibang hospital naman wala. Pero be sure lang na lilinisin mo yung cuff kasi if there's an infection or contagious disease na kumapit dito sa may BP cuff, delikado yun. So, if you are using your personal BP cuff, better na nilalaban or nililinis yung BP cuff. Natatanggal naman to okay? Yung rubber, yung pinaka-cuff natin, andun po sa may loob, rubber po yun. Pwede yung tanggalin and then lalaban mo itong tela na nakabalot. You can do that. Okay? So you have to wipe the cuff with an approved disinfectant as much as possible. Okay? Kung personal naman yan, tsaka ginagamit mo lang naman yan for the client, well, it's up to you. Okay? Pero para sa akin kasi, yung mga personal ko na gamit, I make sure na dinidisinfect ko yun. Okay? So after reading it, after getting the results, okay, remove na natin yung BP cuff natin, and then evaluate na natin and document na natin yung nangyari. Okay, of course, you have to document the blood pressure in the vital signs record sheet. The vital signs record sheet is something that I'm going to teach you guys maybe by next week. Okay, what else? Report natin dun sa may nurse or sa may clinical instructor natin if there are any abnormalities na nakakita natin sa pag-check ng BP ng pasyente natin. Ano pa? Document din natin the procedure in the client's record. Okay, chart natin dun. So, what else? So, yeah, that's it. That concludes the BP taking. If you have some question, guys, you can ask me during our lecture. And also, I will send you another video para sa ganun mas malinaw yung makikita ninyo because what I'm doing right now is I am actually discussing it to you. At the same time, demonstrate it to you. And fortunately, ang hirap talaga mag-demonstrate through online, yung mga pre-recorded video, and also mag-isa lang kasi ako ngayon dito sa may laboratory, so medyo may kahirapan. So I'm going to send another video and I hope makatulong yun, and I hope marami rin kayo natutunan sa naging demonstration ko ngayon. Okay, so for your question, guys, doon na lang tayo sa may natin, sa may online discussion natin. Magtanong kayo ron, or you can also send me a message, or pwede kayo mag-comment doon sa may GC natin. Okay, so yeah, that concludes our discussion for the BP taking. Tanggalin natin lahat ng mga kailangan tanggalin sa may pasyente natin. The BP cuff, okay, the sphygmomanometer, or the BP apparatus, it's the BP apparatus in general. And then pumunta tayo rin sa may client po natin. Okay? So yeah, that concludes our discussion for the vital signs taking. Thank you very much, guys, and I hope meron kayo natutunan sa naging discussion natin dito. Thank you, guys!